This is a special education video series, and my today video is about quitting smoking for adults. What are the benefits of quitting smoking? What should I do if I want to quit smoking? How can my doctor or nurse help? What are the symptoms of withdrawal? Get help right away if you are thinking of hurting or killing yourself. How does counseling work? How can medicine help me quit smoking? Can vaping help me quit? What if I'm pregnant and I'm smoking? What if I've already smoked for a long time? Will I gain weight if I quit? What if I'm having trouble quitting? What else can I do to improve my chances of quitting? These are certain questions which need explanation. So, the question number one: what are the benefits of quitting smoking? Quitting smoking can dramatically improve your health and help you live longer. It lowers your risk of heart disease, lung disease, kidney failure, cancer, infection, stomach problems, and diabetes. Quitting smoking can also lower your chances of getting osteoporosis, a condition that makes your bones weaker. Quitting is not easy for most people. It might take several tries to completely quit, but help and support are available. Quitting smoking will improve your health no matter how old you are, even if you have smoked for a long time. What should I do if I want to quit smoking? It's a good idea to start by talking with your doctor or nurse. It is possible to quit on your own without help, but getting help greatly increases your chances of quitting successfully. When you are ready to quit, you will make a plan to set a quit date. Tell your family and friends that you plan to quit. Plan ahead for the challenges you will face, such as cigarette cravings. Remove cigarettes from your home, car, and work. How can my doctor or nurse help? They can give you advice on the best way to quit. They can also give you medicine to reduce your craving for cigarettes, withdrawal symptoms that happen when you stop smoking. Your doctor or nurse can also help you find a counselor to talk to. For most people who are trying to quit smoking, it works best to use both medicines and counselings. And there is also a website available which help you online. What are the symptoms of withdrawal? When you stop smoking, you might have symptoms such as trouble sleeping, feeling irritable, anxious, or restless, getting frustrated or angry, having trouble thinking clearly. These symptoms can be hard to deal with. This is why it can be so hard to quit. But medicine can help. Some people who stop smoking become temporarily depressed. Some need treatment for depression, such as counseling, medicines, or both. People with depression might no longer enjoy or care about doing the things they used to like to do. Feel sad, down, hopeless, nervous, and cranky most of the time, almost every day. Lose or gain weight, sleep too much or too little, feel tired or like they have no energy, feel guilty or like they are worth nothing, forget things or feel confused, move and speak more slowly than usual, act restless and have trouble staying still. Think about death or suicide. If you think that you might be depressed, tell your doctor and nurse right away. They can talk to you about your symptoms and recommend treatment if needed. Get help right away if you are thinking of hurting or killing yourself. Sometimes people with depression think of hurting or killing themselves. If you ever feel like you might hurt yourself, us help is available all the time. Call your doctor and nurse and tell them that it's an emergency. You can call for an ambulance service. If you think that your partner might have depression or if you are worried that they might hurt themselves, get them help right away. How does counseling work? A counselor can help you figure out what triggers you to want to smoke and how to handle these situations, how to resist cravings, and what you can do differently if you try to quit before. You can meet with a counselor in one room session as a part of a group. There are other ways to get a counseling too, such as over the phone, text, or online. How can medicine help me quit smoking? Different medicine work in different ways. Nicotine replacement therapy. Nicotine is the main drug in cigarettes. And why they are addictive? These medicines reduce your body's craving for nicotine. They also help with withdrawal symptoms. There are different forms of nicotine replacement, including skin patches, lozenges, gums, nasal sprays, and inhalers. Most can be bought without a prescription. Also, health insurance might cover some or all of the cost. It often helps to use two forms of nicotine replacement. For example, you might wear a patch all the time and also use gum or lozenges when you get a craving to smoke. Varenicline, brand name is Chantix. This is a prescription medicine that reduces withdrawal symptoms and cigarette cravings. It can increase the effect of alcohol in some people. Avoid or limit drinking while you are taking it, at least until you know how it affects you. Even if you are not yet ready to commit to a quit date, varenicline can help reduce cravings, and this can make it easier to quit when you are ready. Bupropion, simple brand names is Zepan. This is a prescription medicine that reduces your desire to smoke. It is also available in a generic version, which is cheaper. Doctors do not usually prescribe the bupropion for people with seizures or those who had seizures in the past. It might also be helpful to combine nicotine replacement with bupropion or varenicline in some cases. A person might even take both medicines. Your doctor or nurse can help you figure out the best combination for you. Can vaping help me quit? Vaping is usually electronic cigarettes or e-cigarettes. Sometimes people wonder if vaping can help them quit smoking. Doctors recommend using medicines and counseling to quit smoking. Vaping might be less harmful than smoking regular cigarettes, but e-cigarettes still contain nicotine as well as other substances that might be harmful. What if I'm pregnant and I smoke? If you are pregnant, it's really important for the health of your baby that you quit. Ask your doctor about your options and what is the safest for your baby. What if I have already smoked for a long time? The longer you have smoked, the higher chances are of having health problems. But it is never too late to quit smoking. It helps your health even if you are older or have smoked for many years. The best thing you can do to lower your chance of having a health problem caused by the smoking is to quit. Will I gain weight if I quit? You might gain a little weight. This can be frustrating for some people. But remember that you are improving your health by quitting smoking. You can help prevent gaining a lot of weight by staying active and eating a healthy diet. What if I'm having trouble quitting? If you don't quit on your first try, or if you quit but then start smoking again, don't give up hope. Lots of people have to try more than once before they can completely quit. It might help to try to understand why quitting didn't work. There might be something you can do differently when you try again. It can help you to figure out which situation make you want to smoke so you can avoid them. What else can I do to improve my chances of quitting? You can get regular exercises. Any type of physical activity, even gentle form of movement, is good for your health. Physical activity can also help reduce the stress. Stay away from people who smoke and places that make you want to smoke. If people close to you smoke, ask them to quit with you and avoid smoking around you. Carry gums, hard candy, or something to put in your mouth. If you get a craving for a cigarette, try one of these instead. Don't give up. Even if you start smoking again, it takes most people a few tries before they succeed. Thanks. Keep watch on my channel and subscribe to my channel. Thanks.